Hello, everyone. My name is Gurjat Basra, and I'm the Manager of Patient Programs, Research, and Advocacy here at Lymphoma Canada. I'm pleased to welcome you all to the final session of the day titled Exercise and Wellness for Lymphoma Patients. Just before we start, I want to go through a few housekeeping items. As always, I promise today is the last time you'll have to hear about the housekeeping items, potentially for a year. This Zoom software does not allow you to access your camera or your microphone. So if you do have a question, please be sure to enter it into the chat box and we'll be sure to answer them at the very end. Additionally, this webinar will be recorded and it will be made available on our website, and you'll also receive the links on how you could access these recordings. So with that said, to introduce our speaker here today, we have Dr. Nicole Koulas-Reid, who is a professor of health and exercise psychology in the Faculty of Kinesiology. She's also an adjunct professor in the Department of Oncology in the Cummings School of Medicine and director of the Health and Wellness Lab and Thrive Center. She holds a research associate appointment with the Department of Psychosocial Resources at the Tom Baker Cancer Center, Alberta Health Services, and is a Killam laureate. So thank you, Dr. Koulas-Reid, for joining us today, and you can get started as soon as you're ready.
Perfect. Well, thank you very much for the introduction, Gurjat, and thank you to Lymphoma Canada for having me. And welcome, everybody. Thanks to joining in the afternoon, late afternoon, early evening, wherever you are across Canada. I'm really excited to speak with you a little bit more about the role of exercise for living well across your cancer journey. Before I begin, I want to acknowledge that no matter where we live and work across the territory, that we are on the traditional territories of First Nations people across Canada. We recognize the land as an act of reconciliation and gratitude to those whose territory we reside on, and acknowledge the many First Nations and Métis who have lived in and cared for these lands for generations. Just my one disclaimer is really point to that I'm the co-founder of Thrive Health Services, which you will see later on in the slides, and that these slides are the property of myself and the University of Calgary. So what I'm going to do this afternoon, this evening, wherever you are, is talk about the evidence very, very briefly, and really the gap that we have between the evidence and what we see as available to you, patients or family members in clinical care. I then want to talk a little bit about the pieces that you can really access in terms of supporting your exercise behavior change and accessing in particular resources. And we do have one program that is available potentially for you Canada-wide. So let's start with the evidence. We have tens of thousands of studies looking at exercise for individuals with varying types of cancer and at various points across that timeline. And we have more than 2,500 randomized controlled trials. So that's really your highest level of evidence showing the potential safety and efficacy or effectiveness of exercise for people living with cancer. And what we know from this work is that really first, exercise is absolutely safe across the entire continuum. So that's from pre-treatment to living with an advanced cancer. And it is potentially beneficial. And those benefits, as you'll see in just a minute, they really may vary depending with where somebody is along the treatment continuum. For example, as someone is during treatment, we may not be using movement or exercise to really get benefits, but to help them maintain function, to help them feel more empowered or in control, and to improve maybe their psychosocial well-being or their overall daily activities and their function. Post-treatment, after the body has naturally recovered from some of the side effects of treatment, is where we might be expected to see exercise in terms of more of the benefits, improvements to fitness, improvements with symptom management and diminishing potentially long-term or late effects, and improving overall quality of life. Where we're seeing research really grow is in both ends of these continuums. So using exercise earlier from the point of diagnosis before treatment in a world called prehabilitation, as well as at the other end when we look into longer term survivorship, and in particular for those who are living with potentially an advanced or metastatic cancer. With improvements in treatments comes a longer timeline where individuals really can focus on their quality of life and how do they live well with a cancer. And exercise may play a very important role there in enhancing that quality of life by helping to manage symptoms and side effects associated with ongoing treatments and the cancer itself. From the evidence, we know that there are some areas where we've had a lot of pieces studied, so the outcome's been well studied, versus less on some of the others. So as you can see here, some of our indices of emotional well-being, anxiety and depression, fatigue, which is the #1 side effect across all individuals with cancer, function, some outcomes like lymphedema, and overall quality of life. Those are the domains where we see strong evidence for the positive effects of exercise. Then you move into that moderate evidence column, and we've got bone health and sleep. So sleep different than fatigue, but obviously related. And we've got really emerging evidence, I would say, there showing the benefits. And then we've got a whole host of outcomes that are in this inconclusive column. Now, that doesn't mean that exercise isn't potentially beneficial. It means that we don't have a significant body of research that we can pull together to see consistent findings as of yet. But lots of research going on, on things like chemotherapy-induced peripheral neuropathy, or using exercise to enhance cognitive function and that brain fog, right? So lots of work ongoing, but really strong evidence overall that we can use exercise for both physical and psychosocial benefits for individuals. In addition to all of those kind of here and now, the changes that we can see from exercise, we know that there's an association between being physically active and long-term outcomes. The survival benefits of exercise are really quite impressive, with upwards of 40 to 50% risk reduction in individuals who are regularly active versus those who are inactive. So across the board, different cancer types, we typically see in this literature that modest amounts of moderate to vigorous activity, so upwards of about 90 minutes a week. So think about that in terms of like 30-minute walks a week, that you're brisk walking, like you're late for an appointment. That level of activity is associated with reduced risk of cancer recurrence, reduced risk of cancer mortality, and really importantly, reduced risk of all-cause mortality. Okay, so this is association types of evidence, so large population health studies where we look at people with cancer over time and their activity levels, and we look at these rates of recurrence or death. And so that risk reduction, again, varies depending on which type of cancer has been studied. But across the board, upwards sometimes of 40% risk reduction by being physically active. So really strong evidence supporting the value of exercise. Now, there has been less research specifically in lymphoma. So I put up here, these are two separate articles. The top one in blue there was published in 2019, and it included 6 randomized controlled trials. The second review was published in 2022, and there were 12 randomized controlled trials. So you can see that the evidence is really growing. And I think since 2022, there's been, from my quick look at the literature, 15, 20 more studies, different types, not all RCTs, but different studies looking at the value of exercise for individuals with lymphoma. Across the board, this evidence really does show that, first of all, exercise is safe, especially when it is supervised. And the second piece is that we see some benefits in terms of management of fatigue, enhancing emotional well-being, improving function, and enhancing overall quality of life. But again, in the grand scheme of it, lymphoma has been one of those populations that has really remained understudied, and therefore specific interventions to look at some of the very specific and negative side effects, such as cancer-related fatigue, have been less studied with this population. So while we have this evidence and really growing in lymphoma, but really strong evidence across kind of all comers, so mixed population studies with breast cancer, prostate cancer being our 2 most studied populations, strong evidence showing exercise is really good for people with cancer. The bad news is that this isn't translating into what we see in terms of how active, physically active individuals living with and beyond cancer are. So some of the earlier literature really showed that very few people remain active during treatment, which may not be surprising, right? Treatments can be harsh, many side effects. It can be very hard to manage treatments alone and additional appointments, never mind fit, structured exercise in. We also see comorbidities with a lot of overweight and obesity reporting during treatment, as well as into early survivorship. More recent work has shown that only about 17 to maybe upwards of 40% of individuals meet our physical activity guidelines. And you'll see specifically what those guidelines are in cancer care, but those are really low numbers. And the most recent work published in 2023 took a look at large numbers of different populations and found that 93% of individuals did not report being sufficiently active to achieve health benefits. Okay, so we've got this evidence on the one hand that shows exercise is important, can help manage symptoms, improve well-being, enhance overall quality of life, and is potentially associated with survival. And then on the other hand, kind of in the real world, we see that individuals are not being regularly physically active. So we've got what I like to call as our gap in moving our evidence to practice, right? Clearly, the evidence is there that exercise must become a standard part of supportive cancer care, and yet that hasn't translated to what happens in clinical practice. So to address this gap, a number of suggested steps are starting to be maybe more looked at or implemented in some cases into clinical settings. And I would say if there is one thing that has started to be done across clinical cancer sites across Canada, is that there is this awareness and sometimes the use of or recommendations of these cancer and exercise guidelines. So if you're familiar with physical activity guidelines, if you've ever heard of some of the initiatives from even the Canadian government, like participation, right? There are guidelines there that are about how many minutes a week you should be getting of exercise and the different types of exercise to optimize health outcomes. So with all of that exercise and cancer research that has been done, there have been a number of different bodies that have pulled together these cancer and exercise guidelines. So this is specific to individuals living with and beyond cancer. And the guidelines actually look very similar to what they are for healthy older adults. Okay, a little bit less, but 90 minutes of moderate intensity aerobic exercise. So that's your walking, your cycling, your jogging, dancing, anything that works your lung and your heart, your cardiovascular system. 2 days of strength training. So that's anything, even using your own body resistance, but it could be those, stretchy bands, it could be light weights, it could be machines, but 2 days of strength training are in the guidelines. And then stretching, flexibility training, range of motion training, every day of the week. So this is based on best evidence, what will optimize health outcomes. Along with the guidelines are these recommendations. And these again are evidence-based. So what do we know from the 10,000 plus studies and more than 2,500 RCTs is that first, exercise is safe and feasible during treatment. It can improve some indices like functioning, fatigue, and quality of life. And so the guideline recommendation is to avoid inactivity and return to normal activities as soon as possible following diagnosis. The second recommendation is very clear that after treatment, exercise is not only nice, but it's essential for recovery and fitness. So we can see improvements in physical side effects and growing evidence for many others. So things like management of late and long-term effects. And we know it continues to enhance individuals' overall well-being and quality of life. However, here's the big caveat, this third point. While we have these guidelines and they're very general, they're the same guidelines that would be put out there for everyone, we know that in order to optimize the benefits of exercise or physical activity, that we have to not just give people guidelines, but we have to individualize and tailor those guidelines to meet people where they're at, right? So you may imagine if you're listening tonight and you're the individual who's gone through your lymphoma diagnosis and subsequent treatments, or you're the family member and supporter, that sometimes thinking about, well, could you have gotten 90 minutes of walking during your initial phases of treatment or during management of your disease, or even now, right? If you're into a longer term survivorship, could you do the strength training if you didn't really know what that was all about and what to do? Because if you remember, if you go back to this slide, it's not just strength training, but it gives you some specifics on the screen here. 6 to 10 exercise, 1 to 4 set, 6 to 12 RM, what even does RM mean? And your major muscle groups. So if you have an exercise background or you've exercised before, this may make sense. But for the vast majority of people who are coming into a cancer diagnosis, and that's what they see as the guidelines handed out in a brochure, might not make a lot of sense. And this individualizing and tailoring are absolutely what is necessary to make sure it is safe for each body that is moving, and to make sure that we can optimize the potential benefits for you, depending on what access to resources and programs you have, what have you maybe done or not done before, and the support that you have for this. So it goes beyond your cancer diagnosis and treatments to tailor to many more factors that we know will support you in either having exercise become part of what you do or not. So education is the first part, but we absolutely, if we're going to address this gap of getting people to be more active, we need to move beyond simply those guidelines and even the tailoring of the guidelines to building more exercise oncology resources and exercise oncology resources that are part of the supportive cancer care that you would receive in a clinical setting. So before I go into some of the actual programs and exercises you can do, I want to highlight that the value of this is only as good as the supports that you build around you. So I could literally teach anybody on the call tonight how to do some squats, how to do some strength training, how to get minutes in for movement. But really, it's about your mindset and having the support around you, a positive environment around you that can really help you sustain exercise behavior change. And while we have those guidelines of that moderate to vigorous types of activities, any movement counts and really mild levels of activity, a light walk, especially when you're feeling not well or when you're going through a lot of additional stresses, that might be what your body actually needs to feel well. So, our key message from all of this tonight is simply to move more, right? Even as you're going through the next 2 days of your conference and listening to talks, while you sit there, can you roll your shoulders or can you get up and down out of your chair a couple times, right? Moving more, sneaking in a little bit of movement to your usual activities can be very beneficial. And it's okay to start with and to even get less than what the guidelines are. While we would love for every individual to hit those guidelines or go even beyond them, for some individuals, what works for their lifestyle, what feels good for their body might be 15 minutes of a light intensity activity every single day. And that might be what they work into their lifestyle and what they can sustain. As you start to move more, remember that you're the best expert in your body. Movement should always feel good, okay, when you're doing it, and you should feel good after. Okay, it's not the Jane Fonda era of no pain, no gain. If you remember the fitness craze back in the, I don't know, 70s and 80s, whatever that was, listen to your body as you move. And if something doesn't feel good, make sure you're checking with a qualified exercise professional or your medical care team to make sure it feels safe or is safe. Taking control and the piece of using exercise is really that this is a choice that hopefully the system can help support, but you're ultimately going to control what you choose to engage in and how you can enhance your well-being and health. We know that exercise can help to increase your energy, especially if you're dealing with cancer-related fatigue, can reduce the impact of negative symptoms, and help you regain a sense of normalcy. Okay, so it's something that you can do to focus on being well. Ultimately, all of the research consistently shows that individuals who report being more physically active or engaging in exercise also report a higher quality of life. Okay, so helping to build some of your self-regulatory skills, skills that will help you beyond knowing how to exercise, but how to motivate yourself to get there, how to keep yourself accountable, can be really critical in accessing this and in supporting your wellness. So tonight you're receiving education, right? And that's a part of the behavior change process. The other big things we know are things like enhancing your social support to be active, setting goals. And with those goals comes the ability to track and readjust them and to help you plan for your days. When you know your goal is to get 15 minutes in of a walk, you can look at your calendar and then plan where is that going to actually fit in. And then the other big one is to manage barriers, especially as you're going through treatment or on maintenance therapies. Understanding and managing those barriers to figure out what, again, fits for your lifestyle and for your body can be very important. We have a lot of resources that can help you get started on these. So you'll see a website at the end, but there's free resources that you can just download to think about to help you get started on this exercise behavior change. Out of all of the behavior pieces, the skills you can learn, goal setting is probably one of the best evidence-based ones that can really get you going. It can set your pathway and help you stay accountable. So you can do these SMART goal settings like you see on the screen, but the other piece that we like to build into our programs is what we call our MOVE goals. So identifying your motivation, your opportunities to move, what value, and I mean core value, does this resonate with you? Is it independence? Is it health? Is it social energy for social interactions? And then look at the enhance. What are the physical and mental and emotional well-being benefits that you might start to see with more movement? That then builds into then the motivation again to keep going. So we've got more on these, and I have the website at the end as well, but these are all downloadable infographics or booklets or resources. The other piece that we have is what we call our Thriver Manual. So this is kind of an all-in-one document that's got 10 different chapters around how to get active, the role of exercise in your well-being, the guidelines and more information there, and then other behaviors like self-compassion and nutrition and sleep and stress reduction. So this is a really great wellness guide. And again, it's completely free. You can download it, and the website again will be up at the end. And then these are just examples of more infographics, ones that can get you thinking about how to build social support if you don't feel like that's there, or how to plan for maintenance. So once you get started, that's first step of behavior change. To really get the benefits of exercise, it's about continuing to engage in that behavior change, which can be really hard. Most of us know exercise is good for us, and yet even in the general population, less than 40% of individuals are regularly active. And then as you saw, those numbers go up even, or down, I guess, more inactivity, less active with a cancer diagnosis. So it's hard to maintain a change. And there's lots of these tips and resources that we've built that you can absolutely access for free, that may be beneficial as you move in your wellness journey. Together, we like to think of this wellness behavior change as these interlocking steps, and there's not a specific order for them, but it's really about starting. Anytime we think about making a change or developing a new habit, is find your motivation and what do you enjoy. Most of us aren't, gluttons for punishment, and we're not going to keep doing something over and over again, even if we think it's good for us, if we don't enjoy it. Okay, and then as you find what that is and set your motivation, that move goal, committing to your progress, one step literally sometimes at a time. Okay, it's little steps over time that will help make that change and help you transition from somebody who doesn't see themselves as a mover to someone who may say, part of who I am is an exerciser, and I do that for my health and wellness. Make it fun and social. Plan for those barriers, and we've got those resource sheets for that, and then celebrate as you start to achieve the steps that are on your journey, right? And that journey can look like this, up and down. It might be a little smoother, but for most of us, it's not just this straight line from start to finish. So just keep that in mind and give yourself grace as you think about building more movement or exercise into your usual routine. The last resource before I tell you about an exercise program is through our website at the University of Calgary. We have a YouTube channel, and on that YouTube channel is a whole host of free exercise resources. It says our 8-week exercise oncology plan here. That's an old screenshot. We have 12 weeks of our exercise oncology program. We have a yoga program. We've got all sorts of individual exercises. So this can be a really great resource. It's taught by qualified professionals, but it is used at your own pace and own risk. There's not somebody supervised doing it with you live, so just keep that in mind, but a great resource that you can maybe tap into. The last piece I want to tell you about is a current program, an exercise study that is ongoing as we speak across Canada. So the Excel program is Exercise for Cancer to Enhance Living Well, and I want to acknowledge the team that is built across Canada to do this, and also our funding partners that you can see here on the screen. Excel is a study looking at how we can build exercise in communities for you. So it is for all individuals with a cancer diagnosis, from diagnosis up to 3 years post-treatment completion. The piece for Excel is that we're really targeting individuals who are outside of our major urban centers. If you're listening tonight and you're from Alberta, in Alberta, we have a program called ACE, the Alberta Cancer Exercise Program. ACE is primarily in our urban cities across Alberta, though. And so Excel really was built to start to address gaps even in Alberta, but then bring that model to rural, remote individuals outside of centers across Canada. So if you think you might be interested, at the end, you'll see contact information. This is for adults, have to be able to consent in English and participate in low to moderate activity. Because we are reaching out across Canada, most of our programs are also online. So just like the call we're on tonight, you're on Zoom, but the difference is you're in a class setting and your cameras are on, so that you can be supervised by the exercise professional who's teaching the class. Excel as a study has a process. So once you come in and you can self-refer to Excel, or your clinical team can refer you, you're screened by our clinical exercise physiologist to make sure it's going to be safe. We obtain medical clearance if needed, and then you are into a class that is either led by that CEP or it is led by one of our other trained and qualified exercise professionals. You can see an example on the screen here. is people working out from wherever they are, using whatever they have. So you can use your own body weight, you can use weights, you can use bands, and then you've got an amazing and well-trained exercise instructor. The actual program is 12 weeks. It's group-based. It's a free program as part of the study. You get 2 sessions a week that are 1 hour each. And we have a bunch of different classes and timings to account for Canada and time zones clear across the country. You get a multimodal program, meaning that you get aerobic activity, strength and functional training, balance work, and flexibility, and a nice cool down. Again, it's on the Zoom. You have a qualified instructor plus another person to assist and make sure it's going to be safe for all of our participants. Within our program, we're about, yes, teaching you the exercises, but it's about supporting behavior change. So we have a series of resources and additional webinars on different topics that have been identified by our patient partners as relevant. So we talk about cancer-related fatigue, we talk about building long-term maintenance, the importance of self-compassion in your health and wellness journey, and we touch upon some other health behaviors and how those may change in relationship to exercise. You know, it was the hope with this Excel program that we'd be able to connect with people across Canada. And even though it's on Zoom, still form those community and that social support network. And since we started delivering this program in the fall after COVID started, so in 2020, we currently have more than 1,400 participants across Canada, representing every province and our territories. And so it has been successful to date, and it is still going for another round or 2 of implementation. I've got a couple quotes up here, and you can see from the participants that it's not just the physical benefits of an exercise program, but they're really feeling some of these pieces that we know exercise can be associated with, including that support from other participants and the support from the instructors. So it's strong mind, strong body, and really empowering individuals to feel well and to live with hope. So with that positive message at the end there, I thank you for your time. As you can see here, I've got some resources up on the screen, the 2 websites there. And if you want information about the Excel program or any of these other resources, the best email is my lab, wellnesslab@ucalgary.ca. And somebody from my team will generally get back to you within a week. But those 2 resources there, the Thrive for Cancer Survivors has got that YouTube channel and some other resources on the site. And then the Thrive Health Services has that Thriver manual and a lot of the different handouts that can really help you think about these different elements to support your wellness behavior change. So with that, I am happy to take and answer any questions that you post in the chat. And just remind you that, you know, if you use exercise as medicine and start building it into your usual lifestyle, you may see a number of benefits beyond changing your fitness. Thank you again for your time, and thank you to Lymphoma Canada for the invite to be with you here this afternoon and evening.
Thank you, Dr. Kulas-Reed, for that informative presentation and for mentioning all of those great resources as well as that study. Just a reminder to the audience, if you do have a question, please be sure to enter it in the chat. We have had some comments saying excellent presentation, so thank you for that. I have a question here saying, are there specific tools or equipment you recommend for lymphoma patients who have limited mobility or strength?
Yeah, so I would say, you know, you don't need any equipment. That's the beauty of exercise. So you can start off, and really most of our programs, when we say we start low and progress slow, it really means we're using your own body weight to begin with. So you don't need light weights, you don't need the stretchy bands. You need often a comfortable pair of shoes and some space to move around a little bit in. And many of the activities, depending on what your fitness level is and any significant limitations you may have, we can start with chair-based activities. There's even pieces that you could do lying down, right? So it is really about meeting you where you're at. And then if you have functional limitations, it's tailoring the movement so that it does work for your body. And I think that's one of the best things about exercise or movement as an intervention to support your well-being, is that we can literally take any exercise, and in myself and somebody else, in you, it can look different depending on how you need to do it to be what your body needs.
With that said, I just want to talk about a resource that Lymphoma Canada also has. We recently, within the last few months, released our Coping with Fatigue Guide, and we do have a section on exercise within that. And that also talks on this topic in regards to if you have limited mobility or strength, just like Dr. Coolers-Reed mentioned, you can do lying down activities or chair exercises and that sorts of movement.
Yeah.
Like all movement is good movement, essentially.
Exactly. And I would reiterate that you don't have to do movement for a long period of time to get benefits. So even 5-minute breaks, or you're in your kitchen in the morning making your tea or coffee or waiting for your bread to pop up in the toaster, you can do balance exercises, keeping your hands on the counter, right? So you can work just little movements in throughout your day. It really is that move more message, right? So can you, instead of sitting for long periods of time, break that up with toe taps or leg extensions or up and down or walk around your house even, right? So 3, 4, 5 minutes of movement. And if that's your exercise and you do that a few times from throughout the day, those little chunks can be clumped together and soon enough you're at 15 minutes for your day, right? So don't hesitate to start with just a little bit and see how your body responds.
For sure. And any tips to deal with the emotional challenges that come with not being able to exercise as much as you used to before treatment?
Yeah, I know that can be frustrating. We hear that all the time. I think it is about practicing that self-compassion and giving yourself grace and knowing that if you can start off with just a little bit and stick with that, eventually that little bit can start to build up a little bit more. But yeah, that is often the most frustration we hear is from people who used to be able to do more and they have to start to dial it back. I can tell you though, in some of the work that's been done, even regular consistent breathing practices, so nice posture sitting up and letting your lungs fully inhale and exhale, has physiological benefits. So we can actually see fitness changes from a structured breathing practice, which may not be the same as exerting yourself by going for a strong walk or a jog on a treadmill. But if that's where your body's at and it feels good to do that, the stress reduction, the emotional well-being benefits from that, and the physiological cardiovascular changes. I will also say I have researched yoga for a long time, and I think yoga can be one of the gentle and very best forms of physical activity, because not only do you get the physical movement, but you get that mindfulness practice of just letting your body be in the present, not worrying about the past, what you used to be able to do, and not worrying about the future, what's still coming for you, right? So that mindfulness piece of being present in a yoga practice can be particularly beneficial and maybe help to address some of those emotional and functional needs.
Yeah, that's really great advice. I did previously have a patient come to me as well saying that they were a Boston Marathon runner and, the emotional challenges have been significant with not being able to participate in the marathon this year. So thank you for that feedback. And I'm sure my
Absolutely.
patients can resonate with that.
Mhm.
And moving on, how do you have any tips for patients to effectively monitor their progress and adjust their exercise plans as needed without overwhelming themselves?
So if you're familiar with exercise and you can do that on your own, I think it's about start low, progress slow. So don't try to make big leaps. Take it little bits and little changes at the time. That's often been found to be more sustainable. If this is new to you, though, that's where that value of having that trained, qualified exercise professional as a resource can be really beneficial to ensure that the principles of exercise progression are really addressed. And so, yeah, if you know what you're doing, great, just take it slow. And that's often the feedback we give to people. If you need resources, reach out to us. The Excel program, even if you don't come into Excel, there are trained people in exercise and cancer across the country, trained fitness professionals. And so we're starting to build a bit more of a network where we can make sure that wherever you are, we can provide access and link you up to somebody who has had the training so that they may be able to support you.
Perfect. And we received a very interesting question. It says, do you ever see the day when doctors formally prescribe exercise? It is a strong medicine, as your evidence shows.
Yes, I'm going to be very optimistic. Our goal is to build exercise into standard supportive cancer care. So that means that when you are in a clinical setting, you will be asked Do you want more information on physical activity or exercise? And then that screening would send you to a clinical exercise physiologist in the clinical care setting who could do that more screening and make sure then you are going out to the right resource. Whether that resource is an exercise program in the community, one that if you have advanced needs or a metastatic cancer or other comorbidities, maybe you've had a knee replacement, that you have that clinical exercise physiologist, or maybe there's a functional impairment and you really do need rehab needs. So that screening and asking those right questions can get you to the right resource in hopefully a more timely fashion for many individuals. And I do really think as we see more individuals living with cancer, there is absolutely this need for the cancer care system to start to address wellness as well as, your cancer as an illness, but wellness and living well to enhance your quality of life.
Thank you, Dr. Kulis-Reid. It's great to see how the healthcare landscape is changing in this regard. And with that said, I do also want to just talk about a challenge that Lymphoma Canada runs every year from September 15th to September 30th. Since September 15th marks World Lymphoma Awareness Day, we challenge lymphoma patients across Canada to walk over 100,000 steps in support of the over 100,000 Canadians living with lymphoma. So that's definitely a challenge that you can look forward to next year in case you're interested in participating and getting your steps in.
That's
And
awesome.
yep. And with that said, I just want to take a minute to remind the audience, as this is the final day of our conference and the final session, please be sure to visit the resources tab in the internal conference environment to look through the various patient resources and guides, including the coping with fatigue guide that I had mentioned earlier on. You will have the opportunity to download these resources and send them to your email. Additionally, please be sure to click on the survey tab as well, and we would greatly appreciate your feedback regarding how the conference went. And with that said, it's been an absolute honor being able to host this conference. I hope over the course of 3 days, you were able to get your questions answered and learn more about your lymphoma subtype. And now I would like to direct your attention to attend the closing remarks. Thank you, everyone, and I hope you have a great night. Thank you, Dr. Kulis-Reid.
Thank you. Goodbye, everyone.